Welcome to Music City Fitness with your hosts Josh Gamble and Kat Beach. Talking real deal health and wellness and, well, all around body talk. Their friends and colleagues from across the globe are here to share their views with you too. It's just another day in the journey, so grab a drink and a bite to eat and hang with them for a while as they open up new ideas for you.
Hello, everyone. Thank you for joining us at Music City Fitness. It's myself, Kat Beach, and my wonderful co-host. I said wonderful this time, Josh Gamble.
It's a wonderful, man. Look at you. I'm getting compliments better and better every week.
I'm getting better. I mean, next week your head's gonna explode.
I'll take all the compliments you want to give me.
Amen to that. I'll just serve them up. We are thrilled to be back. This is an extra special edition for me, because we have Dr. Epstein on from 1800VetsNow. And so we'll say hi to you for a quick one. But now I've got to introduce him in an extra special way. Everybody knows Precious on Facebook. And so for my people on Facebook, hello to you. And for everybody out there, I have a Pekingese who I adopted at 9 years old, so a senior Pekingese, and Dr. Epstein is taking care of her through so many different issues with her eyes and a gazillion other issues we won't talk about. But I'm so grateful. I mean, beyond. So wherever he goes, I will follow, and little Precious Bear will too. So everybody sees her pictures, and she's healthy and happy, and I have you to thank for that. So thank you for being on tonight. Myself and Josh have had a lot of questions, so I'm going to get right to it without telling people to click on the website and so forth. Josh and I have had a lot of questions about COVID-19, and I know it's because Josh has a fabulous chocolate.
Yeah, I thought you were going to say.
I always say
you're going to say fat instead of fabulous, and I wasn't going to argue with you. Fat.
Well, he is very full-figured.
He's a full-figured boy. That's true.
So it's precious. But so we have dogs, and we talk about animals all the time, and then we heard about a tiger in the Bronx Zoo, I believe, coming down with COVID-19. So everybody wants to know about COVID-19. So, but I want to jump right to that, but first beforehand, because I think it's really important for people to know this very quickly, and we'll expand upon it later. Can you explain a little bit about 1800VetsNow?
Yeah, so we're a brand new company that provides telehealth services. So our main mission is to help pet owners assess how significant a problem is. So if they're worried about something going on with their pet, they can reach out to us, and we kind of help them decide, do I need to go to a vet? Is this something I can handle at home? Is this actually an emergency? Can this wait? And kind of help give them perspective on what's going on. We have a team of veterinarians and extremely experienced technicians, most of which are 5, 10, 15 years in the field, that you come into our platform and start out with kind of a chat and end up on the phone or even video chats with your doctor or your tech. But it's a platform to kind of help that triage, as they call it, and then also just advice. So if you have general questions about specific breeds or behavior, or I'm bringing a new cat to the house and I'm worried about my other cat or my dog, how do I handle this? So the only thing we can't do is prescribe medications. I can't actually treat your pet. That's not super legal at this point. Yeah. And humans, they can do telemedicine like that because we can tell our doctors what's wrong. But there's a ton of value to having our hands on our patients. And that's one of the things we have to kind of educate a lot of the families that check in with us. Yeah. So we've been really happy with the support we've gotten so far, and the amount of families that have reached out, and the overwhelming amount of applications I've gotten from the veterinary community to be part of this.
So if I'm in Colorado, I'm just going to give you a case study. So I'm in Colorado, and I have a cat, and my cat is vomiting, and I call 1-800-VETS-NOW because it's the second time, and I'm worried about her, and I don't have a vet. How
Yeah. So quick edit. We don't have the phone number up and running yet. It's a website platform. So it's 1800VetsNow.com. And we use Google Meet and Google Voice to kind of interact. A lot of us use personal Google Voice numbers so we can follow up the next day without giving our cell numbers out.
Right. Because it would ring all hours of the night.
But you picked a unique one in Colorado. They actually just waived that law that allows doctors to practice medicine. You would have to catch a doctor with a Colorado license, but the rest of our team, we would treat you like you came into an exam room. I'd ask, how long has this been going on? When did it start? How old is your pet? Has this happened before? And kind of just get a gauge of how ill it sounds like your pet may be. And then determine whether or not we think your kiddo needs care. And if you do, we can bring our map of partner clinics up quickly to figure out who's the closest and call that clinic, get them on the phone, get you scheduled that day, and immediately kind of just hand you right off to them. So it's a way for us to put families in touch with good practitioners that we know and trust, and also for these clinics to find their new clientele.
Oh, that's fantastic. Okay, so that works. That's like a dual.
It's a win-win. So
win-win across
it's been a lot of fun. We've got a few characters that we've encountered so far, but for the most part, everyone that's come to us has been very appreciative and grateful. You know, given the limitations of telehealth, it's kind of a learning experience for everybody.
Yeah. So something interesting, or maybe not interesting to this is going to be interesting. My little Pekingese has become very used to me being home now. And so I went out to the chiropractor the other day and I came home and she dumped everything from a couch on the floor. I don't know how she did it. She levitated. You hear her in the background? Yeah, she levitated, got it all over the floor. And then and there she goes. And she's starting to scratch on things right now. She's never done this before. But when I'm on the phone or on Zoom or leave for an extended period of time, she goes nuts. What is that? I'm sure other people are dealing with that.
Yeah, so that sounds very similar to patterns of separation anxiety. And so these kiddos can become pretty dependent on us. Some of that codependency or hyper-attachment is trained in puppyhood with people that are just never away from their pet. And then when it's finally time to separate, they don't have that confidence or that independence. Or in situations like this, our kiddos get used to having us around 24/7, 7 days a week that they haven't had before. And so it can become their new normal and become kind of their lovey, their blanket is to have you around. And when that goes away, they kind of get in this panic mode. And there's actually some really interesting research going on in England, I believe. They haven't published it yet, but they're kind of figuring out there's a ton of different categories inside of separation anxiety. We've always kind of called it separation anxiety, but some dogs redirect and destroy things. Some dogs destroy the door that you left through. Some, they use the bathroom inside when you leave, and that's how they express their stuff. That's my dog. That's how they show it. So there's a lot of different ways they show it, and they're trying to figure out for each way that they're expressing it, how do we best manage and treat it and help these kiddos regain their independence and their confidence. And some respond to supplements, some respond to pheromones, some respond to medications, and all of them respond in some way to behavior modification, which is not my cup of tea. But I can point you in the direction of someone who knows a lot more about it than me.
Exactly. And
know your weaknesses.
Some respond to giving them big amounts of chicken when you get home. I'm kidding. It's a joke. Totally.
I hope so.
I'm not kidding, Josh. Yeah, he's keeping his mouth shut on that one. Anyways.
I'm just going to keep that one myself.
Mm-hmm.
I tried to, yeah, that's, she's barking in the background. So anyways, so basically what she's having is separation anxiety.
It's what it sounds like.
Yeah.
And this is a good feel for what it's like on our platform too. Like I can't definitively tell you this is what's going on with her. There could always be something else, but if the pattern is she's 100% normal, and then when you leave or you're not giving her any attention, what she's seeking is that attention and that affection and that codependence that she's built.
Yeah.
And so there's a lot of different ways that we can rebuild their independence and confidence.
So I'm going to
So how many clients or patients do you guys usually work with, maybe overall and like maybe on a daily basis?
Yeah, so right now, as we're still building this platform, we have a pretty small team of doctors and techs that are on every hour. We're getting probably somewhere in the 100+ clients a day that we're managing with our team. But as we expand markets and get into some of these bigger cities, we anticipate 10, 20, 30, 200 like times that number. It's the projections are that we're going to need a big team.
Good. Yeah, it's good. I mean, it's a good problem to have.
Yeah. So we're kind of starting small with where we're really pushing and advertising. That way we don't overwhelm the team while we're building out.
How many cities are you guys in right now?
It's live everywhere.
Okay.
If anybody reaches out to it today, I think we had Oklahoma and Kansas and Pittsburgh and Florida, and we got some organic traffic from everywhere. We kind of use Dallas as our test market.
Okay.
So we're primarily doing a lot of cases in that central Texas area. But if you type in 1800VetsNow.com, I don't care where you are, you'll get our website.
Yeah. Are there any states that have maybe regulations that you guys are running into, like maybe like any roadblocks at all, or is everyone pretty open? I know sometimes different situations, some states are
That's a great question.
More strict.
Yeah. So with telehealth, there's zero concerns because we're not practicing medicine. With COVID-19 and the inability to get a lot of pets to medical offices, a few states have loosened or completely waived the rules for practicing telemedicine.
Okay.
To where it gives you some loopholes to where we could if we wanted to. That's not an area we're planning on getting into at the moment.
Gotcha.
But who knows where this thing is headed over the next 4, 8, 12 months. And that may be something we bring into our platform. But there are practices in the states that have waived it, Colorado, New York, and a couple others that are incorporating that. But you still have to be a veterinarian licensed in the state that you're practicing telemed.
Gotcha.
So I could only do that here. And so we'd have to find doctors in the certain states in order to handle those specific cases.
Right. I had a roommate of mine, one of my good friends, she was a veterinary oncologist. And so she started working on her own. And then she was traveling from different states and she was having to get relicensed or licensed in each state. And it's one of those things when you kind of branch out to do your own thing, you don't think about that part. And so it was like in each state, some of the fees seemed to be a little different. Some of the tests were pretty much, it seemed like, sort of the same, but having to practice in each state, having its own certain license, I didn't know that was a thing. And I could be wrong. I figure with medically, I thought it was more universal, but I think dental and veterinarian, I think each state might have its own different situation.
It's super different. Some states are really easy to get your license. You just prove that you've finished vet school and passed the boards and you have your continuing ed or whatever it is.
Yeah.
States like California have an exam. They don't care if you've been in practice 20 years and it's not easy. I won't ever be licensed in California. I don't want to take any more tests. I can study. I just don't. Nope. I'm done with tests.
You're like, I'm drawing the line here.
Yeah, I've been done with tests. Find a state where I don't have to take a test,
and you're good.
I'll apply for a license if you want me to.
Is there a reason why certain states do that?
To be a pain in the no, not really. Just because they can. I think it has to do with what level of regulation they want to put with their practitioners.
Gotcha.
But honestly, I have no clue.
Right. Okay.
I don't see the point in it. I personally feel like,
and I don't either. I mean, it's not like, I could be wrong, but like the malpractice issues with vets probably I didn't think would be as much as like maybe with patients, like with people, I guess.
It's not just because of the relationship people build with their vet, even when there are medical hiccups, even when things happen, usually people are able to forgive and not push blame. It does happen. I mean, veterinarians have the highest suicide rate of any profession. And so it's something that there's enough clients that someone will still charge for a surgery even though the pet dies, and they'll try and destroy them on social media. And it's hard. I mean, it's a profession that a lot of people overlook as far as emotional toll it takes on you. But yeah,
is that because of compassion? Because that
compassion fatigue and I mean, this is a field that most people get into because of how much they care. And having to watch patients, having to let go of patients because they can't afford a fixable problem, having to let go of patients because of aggressive behaviors at a young age, having to, comfort. I mean, I've had teenagers cry on my hand. Like, I've had tears drip on my hand of 16-year-old boys and 75-year-old men. And, I feel like I'm in a fortunate position that I do have a pretty big heart, and I care a lot about my clients, and I tend to not have it follow me home in a negative way. I tend to be grateful that I'm able to be there for them. But it's not that easy for everybody.
Right. I mean, you got to figure, like we were talking before, I mean, these are like our kids. I mean, like my kids have paws. Like,
oh yeah.
I mean, Bear's my second bulldog. I had my other one for about 7 years. I had zero health problems until about 6.5 years. And then he got a blood disorder. Then we had to put him down, and I put other dogs down, but like this one was mine. This wasn't like our family one, totally different. And so
the first time,
it doesn't get easy, but that first time when it's yours, it's a totally different. And so I get it. My best friend, we were roommates for about 3 or 4 years. And so, and her dealing with cancer, it was a little different. So if she's had a bad day, it usually means that she had to put someone down. So another doctor's doing surgeries, and some are just, I guess, general medicine, I guess you could say. I don't know the correct term, but
general practitioners.
But when you have, a bad day, or you have, someone who's upset because they lost their kid, they deal with that one time. You guys have to deal with that multiple times. So like trying to find, like, you've got to be compassionate, you've got to be there and be supportive. And then someone said you got to almost flip a switch to be like, I got to move to the next patient or the next client. And that's tough. Like, I mean, my hat's off to you guys, because that's difficult. I don't know how. I don't think I could do that.
It has its ups and,
I fall apart. How do you do that?
I personally, I've gotten to a point where I realized that even those sad moments, I know how miserable those patients would be if we weren't able to do that. I know what the end is going to look like if we're not able to do what we do.
Yeah.
And so it really is something I'm grateful to be able to make it as peaceful and happy and kind of a transition as I can. But there are still hard. I mean, there are still ones that I'll never forget that were not just, that shouldn't have happened, and they stick with you. I mean, and we all have them. I mean, I still keep, I don't need to get in. We don't need to turn that into this. This could cycle.
All of a sudden everybody's getting emotional.
This can spiral.
And it's true. But I mean, I was just saying that in the sense, it's like, I know that you guys have to make hard decisions. And I think trying to be compassionate and supportive, and then also they're going to ask you, what should I do? Or then you've got to be the one to make the decision for them, because you don't want the pet to suffer. But some people like hold on too long sometimes. And so it's like, that's, I think, would be one of the toughest decisions. Being like, let's have this person to person chit chat about, okay.
That's probably the hardest thing I've ever done, Josh, is I actually held on to Bugsy too long. And that was he was 17 years old, and I knew that I did. So
I think we've talked about this, because I told you this actually came from the oncologists that trained me, that they would tell their families when they're not sure what's going to happen. They'd say, I'd always rather do this 2 weeks early rather than 30 minutes late.
Yeah.
And here's what's really interesting. As I told you about Bugs, and we were talking about him walking in a circle, and I learned about his brain tumor from you and your colleagues.
Suspected.
Okay, so suspected, but
yeah. That's what it sounded like.
I won't put verbiage to it. I'll just say suspected, but
Yeah.
he walked in a circle and could not walk a straight line to save his life. So, literally. And so,
Like me on a Saturday night after leaving the bar.
I know literally that's about what it looked like, Josh.
We're trying to put a positive spin on this somehow because we're getting.
It's all good.
Let's not go down the rabbit hole. No.
I kind of forgot where it started. I feel like I don't know what question you asked me where I spiraled.
I don't even know. But the minute we get to letting go of our pets,
yeah.
But you know what, that goes to show, because a lot of people who are on my Facebook Live right now are experiencing that, and they're saying things. That's the hardest. It's letting go of family members really hard, but your animals are just unconditional, awesome love. And
so to change things up and make things more positive,
to
tell us a good story. Tell us your favorite animal story that was positive.
Oh man, good story. I mean,
tell us something about puppies and how great they are and how they just.
Oh my
love
God.
puppies. Puppies are.
The puppy breath, the sharp teeth, they just gnaw on everything, the nails that snag into everything.
No, the best. So here's a good one. So I should have sent you this picture because this is one of my favorites about a year ago. This couple came in with a Bernese Mountain Dog puppy named Coach. He's just like a giant ball of fluff. He was like 8 weeks old and already like 16 pounds. Like, he was the size of a briefcase.
Welcome.
He slept on my lap upside down the entire appointment. Like, I sat on the floor and talked to him for like an hour about everything. And he slept on my lap the entire time. And he came back in 4 weeks and was 30 pounds and did not sit still the entire visit. It was like, he was psycho nutcase in a good way. But no, there's some patients you never forget that are good stories. I've got him. I've got my pair of white English bulldogs, Shaq and Diesel, that I'm pretty sad that I don't see anymore because I'm not currently in a hospital. So, but yeah, I mean, there's things that I'm fortunate enough to have been in practice for a while, and I have people that I've connected with as early as my second year out of school that still stay in touch, that are, I would guess, watching this from Colorado. Hi, if you're watching. That was quite a while ago, and I've had families here in Tennessee follow me from hospital to hospital, and that means more than anything in practice. You want a good story, like that's when someone takes the effort to track you down, and it means the world.
Yeah.
And
go ahead.
We have there's something coming on Facebook, and the reason I want to ask it right now, Corinna. Remember Corinna Menace, I'd say a month ago, Josh, we had her on the show. So she's asking, she's a nurse, Dr. Epstein, I'm sorry. Precious, please stop crying.
No, this is Precious's show. This is this is the one she's allowed to be a part of.
Yeah.
Okay, fine. Cry all you want because I'm online.
You still can't hear her. I can't.
She's really crying in the background. So Corinna is asking about transmitting COVID-19. Can pets transmit it? And so she's asking, and Corinna, love you, honey. Love you and all of us
for
love
what you do. Yeah.
Right now, I know she's in New York, so she's in,
oh gosh, yeah,
front line, yeah.
So this is her time off, and she's a huge pet lover, but she wants to know about.
So first disclaimer: I am no expert in infectious disease and epidemiology, but I do know where to get information from, and so there's some really great resources for those of you who want to keep up to date. The AVMA, which is the American Vet Med Association, the World Small Animal Vet Association, WSAVA, the USDA Animal Sciences Department, and which I can't remember what that abbreviation is, and the OIE all do a really good job of keeping updated websites with information about anytime they have a coronavirus that is tested positive in any sort of companion animals. But as far as what we've seen to date in studies, there's really not any concern that we have of companion animals transmitting coronavirus to people. The one thing I would stay cautious with is if you have a sick person, especially if they're positive, that's in a home with multiple people, your pet can be no different than a doorknob or any other object that person can touch. And so the reason that I would be cautious with pets in and around this time is that if you have someone in the home that's ill and your family cat lays in their lap or dog goes in the room and gets cuddles, then those virus particles that are so easily aerosolized and come out via, breathing and sneezing and coughing, they can end up on their fur just like pollen and anything else. And so I would say they can be a vector to carry it throughout the home and from person to person. But as far as our companion animals contracting a disease and getting sick, it's not a concern of ours at this time. There have been a handful of pets that have been shown in laboratory settings to contract it. But there's no evidence at this point that under natural conditions, pets spread it to people or will contract it. So that's the long and the short.
Can you also, and I heard a podcast I follow, they speak with one of the zookeepers down in Miami at the zoo down there. And they had mentioned how people were complaining, like, how can a tiger be tested, but humans can't? But they were saying that it's a different test altogether. So we're not using the test for people. They're using the test for the tigers. But then also it's good to know just in case, like you said, we can figure out if they have it and so far.
Honestly, I have absolutely no idea where the tests are coming from. I know that certain diagnostic labs, University of Illinois Vet School is one of which that has the ability to get samples tested. But where those tests come from, your guess is as good as mine, man. So,
I was just like, they had the podcast I listened to, like every week they have this guy Ron Miguel come on, and they just ask a bunch of questions, just random things, and it's kind of like a funnier sort of podcast. But they talked about that today, and he was like, "Well, I just want to clarify. I'd seen people mention about the testing, and like it's a different type of test. Obviously, it's more stressful because they had to put the animal underneath anesthesia to do the test, and so it's kind of tough for them. So they wanted to do it to see if they could clarify that it did have it, just so it helps them with, like you were just saying, literally verbatim what you were just saying, that if you have it, maybe you don't have to get rid of your animal. It's not the end of the world, but just be careful with who they're around, the separation, the quarantine sort of thing.
Yeah, I mean, there's only been a handful that were very slight positives, and the slight positives in dogs, as far as I understand, the test that they ran will show up a slight positive for both intact and or like partial viral particles, because it's a DNA PCR test. So it's they could have just broken virus particles on them and get a slight positive. And so the only one that I agree, the tiger in New York is one that kind of raised our eyebrows a little, because we're like, I wonder how this happened, because that tiger was actually sick. They had a few of lions and tigers at the zoo had respiratory symptoms. And so that was the unique part, which did lead to a lot of people in the feline community worrying about domestic cats. But again, at this point, there's no data that has shown that they can contract it in any sort of way that causes illness or transmits it to people.
Okay. Good.
As far as
So the other question that I'd had, so I'm lucky enough through the company I work for, the Barry's Boot Camp, we're huge animal lovers. We used to be all for bringing our pets to work, letting people bring their dogs, but since we technically serve smoothies in the majority of ours, we serve food then, so we're not allowed to have the animals in. But they offer pet insurance to the full-time employees. And so I'm through, I believe, Nationwide. But can you just kind of explain to people, so many people ask, because I know when I went a new vet, whenever I adopted Bear, I went in, it was a vet that I've known, but it's a new animal. And so like they, if you want the option for pet insurance, you have it, but I don't know if a lot of people understand the benefits, if it's worth it, things like that.
Yeah, no, that's a really great question. It's something that we talk about, or I talk about with any new puppy, new client, anyone who has questions about it when I'm in practice. And again, this is something people can reach out to us on our platform and ask questions about too. So my 2 cents on pet insurance. There are a lot of companies out there. Some pet insurance companies are modeled the way that human insurance was modeled about 10, 15 years ago. So there are some plans that are very specific as far as what they include and exclude based on breeds and age and maximum for this diagnosis and maximum for this diagnosis. And so there's some that are going to be more affordable. They're modeled a little more like that. And then there are other options that are going to be a little more broad coverage, a little higher on a monthly basis, that can cover as much as 90% of your costs, as long as it is not wellness care, with whatever deductible you choose. So there are some companies where you can be like, I want a $250 deductible and 80% coverage, and that's what you get. And so I think it just depends on everyone's budget and what you can and you're willing to pay on a monthly basis. And from the medical side of things, my rule of thumb is, if something horrible happened, your dog darts out of your car and gets hit by a car, and you have to rush to an emergency specialty center, and you get in the door and they say 50-50 chance, 10 grand is your estimate.
Yeah.
If that's not something you can say, yeah, that's fine, do it, go ahead, and you would want to, then pet insurance is something to think about, because you don't have to think twice in, is my pet going to live, or am I going to go into horrible debt? People that have 7-8 figures in their bank account, they don't have to worry about it.
Yeah, they're good.
But the rest of us normal people, that's a bit, the number one thing that I kind of talk about is, like, you never have to choose between your pet's life and your their kidney. Like, you just you just don't have to put yourself in that position.
Yeah.
The other thing I really like it for on more of a routine basis is families that have pet insurance, especially the more coverage plans, tend to get their pets' issues resolved a little bit more quickly, because they almost always say yes to all the tests. So if you have a dog that comes in that's been thrown up for 24 hours, 36 hours, and it's like, I would recommend x-rays, it's 7 years old. It's probably a good idea to do blood work. We want to just treat the symptoms and do the tests tomorrow or the next day if we're not getting better. That's fine too. And when you have pet insurance, recommending that $300-400 of testing and going, oh, it's only going to cost me $400. I'm going to pay $80. Sure, do it.
Definitely.
Like, you get that compliance, not because of the vet wants to make more money. It's because you get the big scary things off your list sooner. The dog with the foreign body that's stuck in the stomach that you're like, we'll just treat medically and check him tomorrow. It's going to be a lot worse tomorrow if it's actually there. And you're going to find it if you take that x-ray that day. And you don't wait the next day. So you're just able to be a little more proactive. And in the patients that are really sick, you're going to find out faster rather than waiting until they're way worse.
Yeah. I mean, I've always been a bulldog fan. I've had boxers and huskies and a short-haired Saint Bernard.
Talking to a Georgia grad, my friend.
Yes. See, I knew we'd get along. I know you. That's why I like the white bulldogs earlier.
Yeah.
I got it.
My sister did that.
It took me a while to get my first one, because I just knew they just usually have more health issues. And then I was with Bear. He sort of fell in my lap. I knew of a breeder, went down, checked him out. Was going to get one of his litter, and then it worked out. Worked out's the wrong word. Situation happened where the family needed to get rid of the bulldogs they had, and so there's this chocolate bulldog I've never seen before in my life, and they're like, "Do you want this one instead of the puppy?" Because I'm on a waiting list for his litter. And I was like, well, I mean, yeah, he's great. I mean, he's like every other bulldog, lazy and perfect. But then I get skin allergies, and I get, when I got him, and I think part of it was the lack of exercise they got, he had two partial tears, one in each knee. And so we've done one knee surgery, and that was before I had the insurance. And now the other one's a partial tear, but it's already been stated. So it's like, it won't cover it.
Yeah.
Because it's pre-existing. But, like the skin allergies and all the other tests were good. And it's great because, a lot of those like short face, like the Frenchies and things, they have, allergies and issues and health problems. And,
especially this time of year when everything turns yellow from the pollen.
The pollen all over.
Like my car.
Yeah. Literally just a thin layer of, that's with him, because I've had a lot of skin. I'm running into a lot of skin allergies with him. We've had to switch his diet up and do different things. And so
Yep.
Actually,
No,
that was
super common.
Yeah.
Everybody's going through that right now.
Hmm?
Everybody's going through that right.
Oh yeah. I mean, and there's so much you can do for allergies. There's like so many new drugs and options that your vet can talk about. There are new supplements on the market that I'm a huge fan of. There's a ton of companies that have some really amazing topical therapeutics, because really the best way to treat and keep skin healthy is topicals. Like I talk to my patients about this all the time. Like most people take their pet to the vet. They talk about allergies and they treat for the itch, they treat for the inflammation, they treat for the secondary infections that they always get.
Yeah.
They forget the fact that dogs have skin that we need to keep healthy.
Yeah.
We don't really pay attention to like, why don't we, like, humans moisturize and like do all these things to keep your skin healthy, and you do lotions and like that. They have skin too, and especially it's their biggest organ. And if it's already in a constant state of inflammation from the environment, it's really important that we focus on nutraceuticals and things that we can do to keep the skin barrier as healthy and functional as possible. Because we keep the allergens out in the first place, it'll make your life a lot easier.
Yeah, we will be talking off air about the things that you recommend.
Bingo.
This guy,
right, because we can't do that on air.
Because I'm just not a fan of, like I said, I don't remember the name of the drug. A couple of people that live in my complex have bulldogs also, and we've ran into the same skin issues at the same time. And one couple moved from Florida, and they never had the allergy issues down there.
Yeah.
But there was one medication they gave us, and it was like $70 for a bottle, and it was to help. I want to say it started with an M, but don't quote me on that. But it was. I gave it to him once a day, maybe I lied twice a day, and the one vet liked it, and it did help him stop itching. And then another vet friend of mine was like, yeah, it helps trigger the brain to think that you're not itching, so they don't, but it doesn't actually fix.
So you're probably talking about Apoquel.
Apoquel, yes, that's exactly. It's not an M at
so
all. Yes, that's it.
It doesn't have an effect on the brain.
Okay, good. I was like, does it trigger it? They said,
I thought, and honestly, $70 a bottle, you should buy them out. That's super cheap for Apoquel.
Really?
Yeah.
The vet that I have here is amazing. It's my old roommate's like best friend, and everyone here goes to them because they're good family people.
Yeah.
And it hurts my heart that that's cheap, because that's crazy.
Oh, that's a cost. That cost on those are absolutely insane. Wow. Like, it's not that people are like, I'm going to make it expensive. It's
right.
It's an expensive cost. Just like the dog flu vaccine, it's an expensive cost.
Gotcha.
There's certain things that, like, there's not much of a profit margin. It's just an expensive cost to the clinic, and you just kind of have to, like, all right, there it is. But no, Apoquel is a drug. It's one of the ones on the list that your vets can prescribe. That the best way I describe it is it modifies your body's process and to where the signaling molecule, it's a fancy word for it, would be an interleukin, but the little signal your body produces to say you're itchy, scratch here.
Right. It blocks it.
It stops the production of it altogether.
Okay. That's okay. That's probably better to explain what she said.
So when your body's itchy, it's like, hey, send this out. And it's like, yeah, I got none. So you can't even. So yeah, you're spot on with that. Inflammation can still happen, but the itch signal's still not there. But for patients with seasonal allergies, especially if it's like a good 6 weeks a year and that's it, it's a really effective, really good option. And there's there's a injectable cousin that I like as well. So
okay, good.
A lot of good things that are out there.
And that's good to know, because, like, I mean, it's sort of like the vet, a dentist, car mechanic. Most people don't know if you're telling us the truth or not. We're just, I mean, I don't know if I need this filling. I could just have sensitive gums or a sensitive nerve. I don't know if I need to fix something on my car because I'm not underneath there looking. I don't know if the medication is what I need. But so it's building that rapport and that trust, but being able to find other vets like yourself who will just kind of explain things. And not that we're saying other vets are wrong or they're money scammers or anything like that, but you want to find someone that you feel comfortable with and trust.
Yeah. I think to me, the way I've always practiced is it's my job to figure out what's wrong as best I can, come up with a diagnosis, and then bring the owner up to speed as much as necessary, educate my families enough to where we make decisions together. Yeah. I've never been the type of practitioner that's like, your dog has this, here's the drug, go home. It's more of a like, okay, this is what's going on and this is why it's happening. And these are the ways that we're going to get this thing better. And here are our options. And let's see what you want what we're going to choose.
Right.
Because at the end of the day, it's just like when I take my kids to a pediatrician. They have to teach me why they're about to do something and why they're going to do a certain drug. And I'm probably more annoying than most people, but they have to explain to me, like convince me why, so
Right.
I understand and I go along with it.
Yeah.
And if families understand the why, they're going to have that trust with you.
Right. And that's the thing. And I feel like I always tell like my friends, it's like, and I'm not by any means educated on the vet world, but just having a roommate that's around it and just, you kind of pick up on questions to ask. Luckily I'm lucky enough to where like anyone that I've dealt with that's just more general practitioner has been a close friend. So it's been good. So even with the knee surgeries, I went with someone that was great.
Yeah, no, we're lucky. We've got a handful in Nashville that are phenomenal. So.
Yeah, there's a I won't say the company, but there's a company that pretty much I think most people go to that do emergency and vet stuff, and that's where I've sent him my last one. Of course, not before the blood disorder gets the knee surgery. He decides that he wants to be athletic at 7, all of a sudden, and try to jump over the back end of the couch, not off the front.
Oh.
And then
Bulldogs aren't known for their smarts, my friend.
Man, they're stubborn and they are just not the brightest. I think that's why I get along with them so well, because I'm pretty much just like one.
Yes, you are. I'm so glad you noticed that.
Yeah,
I feel like we just had a breakthrough. It's because we have a doctor on. It doesn't mean
that's right. Therapy sessions in. Go ahead and bill me for that one.
Just kidding. Look at
we are like our pets.
Like maybe I'll say nothing at all. Gotta add a little levity. And Dr. Epstein, one more time, because there are a couple, actually a lot of new people on Facebook and who are joining us now. Could you tell them a little more about 1800VetsNow?
Yeah. So again, we're a brand new company that provides telehealth services to anyone who wants it completely free. So we're a completely free service. Probably should have mentioned that earlier. So if you have a question about your pet, if you have a behavior question, you want some advice, your dog's diabetic and you just want to talk about it with someone that knows what they're talking about, we've got a team of experienced vet technicians and veterinarians that are available 8 to 8. We're here to help. We're here to advise. We provide that primarily that tele advice, and then the tele triage side of things, which is really when your pet's not well, helping you kind of decide, do I need to be seen? How can I fix this at home? What do I do? Do I need to go to an emergency room? Do I wait till the morning? So we try to be able to guide you as a pet owner to where you can get the best care, and we have partner clinics throughout the country that we will grab right on the line while we're talking to you and help get that appointment scheduled, get you on their books, especially now with Corona. We're also building a list of clinics that are closed, so which is definitely happening in certain parts of the country. So we're here to help every way we can. The only limitations I've got is we can't diagnose, we can't prescribe. So can't have you call me and show me a picture your dog's red ear and me call in a drug for it. Right. But I can help you determine how long's it been going on. We can talk about the underlying causes. We can talk about, what likely is going to have to happen to get it better and what all the causes could be. And it probably does need to be seen.
Okay.
Which is soothing somebody's mind, because there are plenty of times, and so Josh knows that I go down the rabbit hole too many times, but especially with Precious. So does Dr. Epstein, but
we all get along.
Truthfully, I don't know what you're talking about.
Listen, both of y'all. but truthfully, I'm not the only one. There are plenty of people out there that are watching right now that have a moment where their pet is either vomiting or has diarrhea or isn't eating,
seizures.
Or seizures. That was a Sunday morning, just so all of you all know. I text Dr. Epstein at 8 a.m. I don't know.
That's fine. I have 2 little kids.
Sunday
I'm always awake.
Morning. He's with his children, and I'm like, oh my God, I think Precious is having a seizure. She was having a seizure, and thank God you were there. And so, to be honest, 1800VetsNow is so important, because had you not been there, I would have done 1800VetsNow, because nobody would have been there. for that particular moment.
I mean, you probably would have called the ER and they would have said, well, if she's actively having a seizure, you need to bring her in. If the seizure's done, it's kind of up to you. And they can't really tell you a whole lot other than that.
Right.
Which is really challenging, because that's the difference between $1 and $3. And I will never put a price point on
the dog.
Okay, let's just be honest though. That's between $1 and $2,000 to $3,000.
Yeah, and so it's just determining what's, what could it be, and I think that's the biggest thing that so many pet owners don't. You can't find it quickly on Dr. Google when there's something going on.
Right.
And I'm learning this too, because we have a couple of what we call pet experts that are some of our like vet assistants that we're training up to learn a lot of these things. And I've had a couple of times where I've been like, okay, let's, once you're done talking to this family, let's talk. And it's like, hey, you were talking to someone with a younger dog, hadn't eaten in 2 days. That's never normal for a puppy. Immediately get that person to talk to a vet. Because it's like, well, I don't. So it's about making sure that the families understand where it's like a 6-year-old dog that occasionally doesn't eat for a day. Like, okay, that's fine. You have a 9-month-old puppy that doesn't eat for 2 days. Something is wrong.
Yeah.
Wrong.
Wrong.
The ones that like eat shoes and everything.
Yeah. So
I think that's great what you just said about, because I had a friend who had he had texted me because obviously he knew that I've had bulldogs before with skin issues. So his dog had a skin problem, but it was obviously bulldogs are not the most agile or athletic. So they can't also really reach certain parts of their body to scratch and irritate things. His dog could. And so then he was feeling bad. He's like, I need to take it to the vet, but I don't want them to think that I ignored this too long or that I was something wrong with my dog. And I'm like, well, a vet can probably look and tell if you've done something wrong. I said, but the sooner you go, the better. But the fact that they have you guys to say, hey, here's what I'm looking at. My dog's got long legs. It can reach its back shoulder and this is irritated. And it was, it's good. There's that we have someone to kind of now as a in between.
Yeah. I mean, the first day it's happening, you're like, this is weird. And you can reach out and go, send me some pictures. And I had one recently the other day that was like, I could see the underlying of the skin was like about to be a horrible hot spot. And I was like, you should go in now, because this is going to be $100 visit today or a $300 visit next week.
Yeah.
Like, you need to get this addressed now before it's a disaster. But yeah, no, we can tell when it's like, no, this wasn't there yesterday, versus like, it's been going on a week.
For a while,
because when someone says it happened overnight and there's maggots in a wound, it's not overnight. Oh, seen it. We've all seen it.
Yeah, I was like, I can imagine.
Things you encounter in vet med or
that on TV, movie. Wait, no.
Yeah, but I know, and I understood what he was saying, and like it's like with me, with like I'd send pictures to the vet. I'm like, what do we got going on right here? Like, well, it's it's patchy here, it's this dry skin here, it's this here. Like you can use this stuff here and this cream, and I've got a special like foam sort of like mousse type, that I use, and it's great. And he smears it all over the place, and that's why I've got blankets all over the couches, and that's why he's wearing a t-shirt right now, because it's just he wants to roll around on his back. But when they roll around their back, he's like a turtle who can't flip back over. So it's like he's just gonna sit there and squirm back and forth. So it's just more of a greasy mess. And then I have to help him out. And I will gladly help him out. But that's why we put the t-shirt on. Because it's things like that. Like I send the picture like, oh yeah, you're good here. Yep. If it starts to do this or inflame, let us know. And
and that's kind of the service we can provide is, it's like, I think that you can continue doing what you're doing or continue to keep a close eye on this. These are the things that would make me see you need to get seen by a veterinarian. Or we've had a few where it's like, oh, we got the patients scheduled somewhere in 2 days. And it's like, okay, if this or this happens, just go somewhere.
Yeah, that's great.
I don't care anymore. Or, okay, your dog has an ear infection probably, but you're scheduled
oil on it.
Between now and then, this is what you can do to try and help in the next 2 days.
Yeah, and that's great. And that's why I love what you guys do, because it's one of those things where my roommate would get hit up all the time from people like, hey, and not discrediting anything, but like when you're a specialist, you usually don't deal with that stuff as much, like the general questions.
Bingo.
She is welcome to help anything, but then she's like, well, there's certain things I would probably, deflect to another person who's better CFET because I'm dealing more with chemo and this kind of stuff with these animals. But knowing that there's someplace some people can go because people just don't know. And the fact that you guys offer a free service, because that's the other thing. Like, okay, great. But what are these hidden fees that I'm going to get from them if I try to get these questions and stuff? So I think that's great that you had mentioned that and that you guys give that
Yep.
to people.
Yeah, no, if we end up doing telemedicine and we can actually prescribe and do full appointments and add medical records, there'll be a fee for those clients. But that's not something we have at the moment in any of the states we're really being aggressive in.
Mm-hmm.
So, but it just depends on how Corona progresses and what the governors decide and what ends up happening, because it's pretty clear in most states, Tennessee included, that you have to have that hands-on veterinarian client patient relationship in order to diagnose and prescribe. Mm-hmm. So if you have a vet here that's seen your pet within the last year and you don't want to leave your house because of the lockdown, sure, they can actually do telemed because they've seen your pet within the last 12 months. That's why a lot of people can call their vet and say, it's got that same thing again. Can I have the meds again? And some doctors will approve it and it's perfectly fine. It's been 3 years, not okay.
Right. Okay. That's good to know.
Yeah, we've had a few of those. We had someone ask for a refill of iMeds for glaucoma. I was like, I can't help you.
That's not what we do.
Your dog probably needs those meds though, so go see your vet.
Go see a vet. Yeah,
please.
No, that's good though, because I think that's a common thing. Most people are like, okay, like we talk about, is pet insurance worth it? And I think you made a few good points on, the breed you have, and if you're going to be dealing with issues and the longevity of certain animals and things like that. And then the fact that you guys are able to answer questions and look at pictures and kind of point them in the right direction, because they're going to go to Dr. Google and just be like, ooh, I have red ear on dog. Like, what does this mean?
Down the rabbit hole you go. I will say that when Precious was having her seizure, that was the first thing you said. Please, if you can take a picture, video.
Yep. Yep. I've asked for a video. We've had a lot of people that come on and they say, my dog's breathing funny, or he's walking weird, or he's doing this. And you're like, send a video, because through our platform, you can send pictures, you can send videos, and we can video chat. Most people don't want to video chat. I don't know why. So we end up talking on the phone instead. But
you have to put makeup and do a full deal. I'm kidding.
Yeah, I did my hair like this, but this is only because it's you guys. Normally, my hair is in a rat's nest.
Yeah. I know. It's got to be tough. Very funny. Don't make me. Don't make me. I needed a good laugh today. Thank you, Josh.
Oh, you're welcome. That's what I'm here for.
Dr. Epstein said nothing at all. He's like,
these guys. Like, what would I get myself into?
We're a hot mess.
By we, she means she, but I'm just,
by we, she.
Right. Oh,
it's okay. We'll go with she.
We'll go she. So okay, so we'll kind of change it up a little bit. So you have a boxer.
Mm-hmm.
Do you just have one dog?
I do. I have one. Mm-hmm.
We don't have a bulldog, but you're a bulldog alone.
Not at the moment. Yes. Yeah. Just anything smush faced, I'm a sucker. So
yeah.
So we'll see if I can get her to come. Winnie, come here. Will you come join the party? Are you too scared? You're gonna come up? Come on. Hi. Come here. Oh, you're too scared.
She didn't want.
There she is. That face.
Yeah. World's biggest underbite.
Oh my God.
I know it's.
Oh, it's like a foot.
Look at that.
Mm-hmm. Yeah. Knucklehead right here.
I show Bear. If you can't see, he's passed out on my lap. My legs gone numb. He's good for about 5 minutes of fun, then he's done. I remember I had a boxer, and I didn't realize that their stamina and the breathing was. I was like, oh, someone I can go run with, and it just doesn't work that way.
No.
Then I got a husky, and that husky had more energy than I knew what to deal with. On top of having that coat that just shed, and you know what? Once I realized they could talk, I had the best conversations that I've had with anybody with that dog. We would talk And I'm not going to say that I had been having a glass of wine, but like we would hold conversations and she'll like tell me more. And she was,
I'm not gonna say it was
Huskies do not make good inpatients.
oh my gosh, no chance.
You just put if they're ever ill enough to be in a hospital for a day, it's like having a car alarm go off all day long. Like, it's just
really that bad?
Huskies and white shepherds are very vocal.
Oh wow, I didn't know white shepherds were.
Yeah. Typically.
I had the husky she was gorgeous. I knew they shed. I didn't realize how much. And I got that Furminator, and I can just promise you, and I kid you not, I filled, you take your grocery bags home. I filled 6 bags of hair from this dog, and there was still hair there.
Yeah.
And I'm like,
what is that?
What's that? Furminator? It's like there's a shampoo and a conditioner, and it's almost like a sort of like a brush, and it helps kind of, I guess, with their undercoat. Is that right?
Yeah, it looks like a clipper blade almost. Like it's a metal brush that helps get a lot of the hairs that are about to shed to come on out now.
And you want that because that Roomba did not work. It got clogged. And so there's no maid that will accept that responsibility of brushing that or cleaning it or sweeping it. So
they're groomers, but it's like $150 for a big dog.
I was like,
but it takes forever. Like, I mean, I get it.
They're great. Like I'd had the boxer and I had the husky, and then the bulldog. He'd fell in my lap. I had a friend. He was like, "Hey, my buddy and his wife got a bulldog. Turns out their 3-year-old's allergic to dogs they didn't know. Do you want it?" And so now I'm going from like 2 dogs to like a little pack now. And the husky and the boxer about 3 and 2 and 3. The husky hated the bulldog. He would sit there like a bump on a log, and I'd come home and I'd peek through the blinds outside, and she'd be grabbing its scruff, trying to like toss it. And he would just sit there, and then they'd go out to the bathroom, and of course they'd sprint, and he would, he's the chunk.
Bulldogs don't sprint.
And as they're turning around to come back, he tries to turn around, and the husky would just knock him to the side, and I'd watch him roll like a roly-poly. Mm-hmm. And she knew it too. And I was like, her name was Kiko. I'm like, Kiko. She goes straight inside to her kennel. She's like, yeah, I know I'm in trouble, but it's my turf.
Yeah, they're.
But they were great. I mean, I loved.
They're an odd couple, that's for sure.
We were definitely the odd couple walking around, and I felt bad because the Huskies. It's tough to have them in Tennessee. It's so humid here, and it gets so hot in the summer.
Yeah, you gotta be careful. Bulldogs, you gotta be. I'm more worried about a bulldog in the summer in Tennessee than a husky.
Right.
They cannot breathe and they overheat much faster.
Yeah.
So I've seen more bulldogs with heat stroke than any other breed.
Oh, really? They're just because they
can't breathe. There's no airway. Like their nose is like this, and their trachea is super tiny, and there's salt. Like there's an extra like hand's worth of tissue in the back of their throat. Yeah. So that's why they sound.
Make Precious do like wind sprints because she's the same. Mm-hmm. I said, so I shouldn't make Precious do wind sprints because she's the same thing.
Not when it's 100 degrees outside.
Peaky.
It is in Tennessee, even in the shade. I mean, the humidity is outrageous.
Yeah.
But the good news is we can stay inside the complex indoors and walk and do everything in the air conditioner because I don't want to be out in that heat either. So we're good. We go up and down a couple stairs. We go to the room. We lay down. We take a 3-hour nap. It's fine. We do well.
3-hour nap. That's wonderful.
Yeah.
Nap.
That's all I got to do right now is nap.
Exactly. Nap.
Eat. Go back to nap.
Coffee. Nap. You're all's well. It's interesting. I know, right? You are not napping. Precious is so sold on this, just the very front of my complex, that if I try to get her to walk outside of it, I think it's because she's becoming more blind, and you knew what would happen. It's really interesting. She will sit down with her fanny to me and pointing back towards the apartment. And it's the weirdest thing. And is that common with blind or animals that are going blind, that they can actually smell their home, or she all the way around the circumference of where she's comfortable?
I think that maybe more of it is she's recognizes that I'm just kind of, I have no idea. First of all, no idea. But I'll guess. Yeah. My theory would be that she's kind of become familiar enough with her environment, especially the smell and the larger shapes and what she's able to recognize, And if she gets to an area where she doesn't recognize the shapes or the smells anymore, it may cause some anxiety and discomfort and desire to go back to where she's comfortable. So that would make sense. But
yeah, I have told her on many occasions, I'm like, listen, Dr. Epstein's going to make you on a diet or you're going to walk. You make the choice, buddy.
It's funny. A lot of trainers tell their clients that too, but they don't listen also.
Oh, man.
That's so funny, Josh. Ha! Josh has coached me for.
Oh, no, Precious is fine, but there's some like trying to get large pets to be not large anymore can be quite challenging. So there've been some record setters that I've seen that I'll never forget. This was when I was still in high school and I was still a vet tech assistant, and we had a 129-pound basset hound come in.
Jesus.
It was like an ottoman with feet. It was just like, it was a rectangle with like stumps. And it just,
okay, so tell everyone how much an average basset hound would weigh.
About, if it's a larger structured one, maybe about 55 to 60 pounds, maybe. Like if they're one of the bigger Bassets, maybe 60, 70 pounds, like on the high end. So this guy was, a good solid 60 pounds over, 70 pounds over.
He was two dogs.
He was in one.
Yeah, he looked more like a manatee than a. And like, how do you have that conversation? Like, your dog needs to lose a dog. Like,
what are you doing? Like, let's calm down. So give us your. So we usually do a thing. Your
dog needs to lose a dog.
We usually do a thing at the end of the show. We always ask people like, the top 5 people like you would do something with. Give us your top 5 craziest vet stories.
Oh boy.
Yeah.
Okay. Well,
we're gonna love this.
We'll start. Oh, yeah, this is right. So we'll just make the basset hound number 5.
Okay, fair.
Man. All right. So here's a small world one. I'm not short-winded, so hopefully this isn't like a time thing. I was practicing. I was a relief vet for a while here in Nashville, so I was kind of at every clinic all around, and I was filling in at a clinic that the technician was telling me about this cat that had been boarding there for a while, had been on all these different types of antibiotics with this weird skin condition, and no one ever out, and her skin kind of looked almost honeycomb, like there were just holes in it all over her abdomen. Mm-hmm. And this was September. It had been going on since February. And so that's not a thing you forget. And so I was like started pouring through dermatology books, and I was like, this isn't staph. Like, this is not normal. I don't know what eats skin like that, but it's not a normal thing. And started pouring through some books, ended up reaching out to our dermatology specialist here and got the rescue in touch with her, and then ended up like never hearing any. I got a response from the specialist that kind of was like, thanks for sending her. It was really interesting. I do think it was one of these bacteria, blah, blah, blah. And I never heard anything again.
All right.
And 2 years later, I walk into an exam room for a new client at my last practice and start to kind of get a history. The cat has this weird kind of skin thing going on. And the name kind of rings a bell. It has an owner now. That's where she got her, was from National Cat Rescue. Mm-hmm. And I flip this cat over and look at her abdomen, and there's like honeycomb scars all over her belly. I was like, this has to be. There's no way that there's any other. And I like pulled up my email and found the name of the cat was the exact same name of the cat. I was like, is this from there? And she's like, yeah. And I was like, what are the odds?
Right. Holy crap. Wow.
2 years later, that cat walks into my like a 5-doctor practice, and I happen to be the one that sees them.
Right. That's crazy.
But it was, yeah. So, small world things like that. God, what else do I have? Oh, well, do I have time for all?
Yeah, I know you have some funny people stories with them too.
What if those people are watching? This
is what I tell our guests when they come on. You don't have to give a specific story about you, but you can be like, so a friend of mine named John.
Yeah.
had it.
Yeah.
So then it's not you and it's someone else.
No, most of my stories that I would share are just funny and small world things like that, or patients that I'll never forget. I have plenty of like sad that are in my top 5 like amazing things that I'll never like get over.
Yeah. We want positive,
but we're gonna do positive. Yeah, we're gonna stick with happy. So yeah, so we got our Ottoman is number 5. We got Celia as number 2. Or number 4. I can't count. It's been a long day.
Okay.
Got that pot of coffee ready.
That's right there.
Coffee
ready.
number 3. No.
God, what would my next one be? Positive, happy stories. So, I would say Stella is one of my happy stories. I had a patient of mine that we first met. She had a heart condition and like teeth that were almost falling out, and we were not wanting to pursue, or dentistry is kind of my thing. So we were kind of scared of dentals, but we ended up talking to mom. Mom's a dear friend of mine now, and a doctor that is at Vanderbilt working right now. So hopefully she's staying safe.
What kind of dog or what kind of animal or?
Stella was a pitty.
Okay.
And she was through a rescue, and was a heartworm survivor, and had heart disease and horrible. And she wasn't super active, but she was really sweet, and she was a senior, and ended up deciding to do the procedure. Mom stayed and was on the other side of the glass, like from the OR during the whole surgery.
Yeah.
And after the procedure, she went from, going on a 2-block walk that was like 2 miles to being able to make it like a half-mile walk. And she kind of had some pep in her step, and started feeling better, and ended up having some weird arrhythmia things, and mom and I got real close because she spent a lot of days in the hospital on monitors and hooked up to things to make sure her heart was healthy. We got a specialist that used to practice here in Nashville, a cardiologist, Dr. Piscatelli, who remoted and would talk to me at 10 p.m. from her home just to like help figure out what to do, what was best for Stella. And we probably got 6 months with her we wouldn't have had otherwise if we didn't have a team around her, and a lot of support. And she's one that's always super special. And just seeing how well she turned around is a case I'll never kind of move on from.
Yeah.
I would share number 2 with my 2 favorite dental turnarounds, because again, that's my thing.
That's your deal, yeah.
So I've had both a cat and a dog that it completely changed their life. So I had she was a 14 or 15-year-old little pup that they were terrified of anesthesia, but that it was miserable. And we took all of her teeth out, all like 10 that were left out of 42. So there weren't many left to begin with.
Yeah.
And I mean, she acted probably 6 years younger. She was the life of the complex, going on walks and she was my patient like a year and a half later, still like taking names. And very similar experience on the feline side. And Barney's a case I'll never forget, because he was a kidney disease cat. And they didn't want to do anesthesia because of his kidney disease. And cats get this weird disease where their teeth reabsorb, and once the root's exposed, it's super painful. And so once it got there, he started he'd go to the food bowl and he'd go to eat, and he'd chatter and run away because it hurt. And so that was the point where it was like, all right, we have to do this. I know he has kidney disease. We got to do it. And he did beautifully, did great through the surgery. We did he did great. Mom and dad did a great job. They gave fluids at home before and after to help his kidneys. The best family. And they came in 2 weeks later for his recheck. And I'll never forget what she said to me. She looked and she said, I didn't know I lost my cat, but I have my cat back.
Wow.
He had just slowly changed from chronic oral pain so much that we just accepted that as his new normal. And when we took all of that away, it was he was a
whole new cat.
That gave me chills. It still does.
Well, think about it. I mean, anyone who's had a toothache or something, it changes your demeanor and your mindset and just your attitude in general. But it's I can tell the dentist where it hurts.
Yeah.
you know,
and they're still going to eat. I can't tell you how many eyes I've almost, like, my eyes have almost rolled in a full 360 when it's like, well, he's still eating. I was like, duh, he'll die without food. Like, I don't. Yep.
Yeah, they're going to
still eat with a toothache. I don't know what to tell you. So anyways. All right, this is my favorite. So this goes back to pre-doctor times. In practice, I was a tech in rural Georgia outside of Athens. And I can tell this story because, well, anyways, I was a tech at the time. Very sweet old lady came in with her, what I thought was like a Chinese crested. It was this little Chihuahua looking thing that was scrawny and like oily and had like random like flecks of hair sticking out, and just it didn't look like a normal. It didn't look like the body shape of a Chinese crested, but it had the skin of a Chinese crested. And she's like, "Oh, he's Chihuahua. He just because that's always been." I'm like, okay. And getting my normal history, talking through, like, okay, blah blah, preventions. All right, well, what are you feeding him? Churches. I'm not familiar with that. I'm not familiar with that brand. And she said, no, Church's chicken. I get him a fried chicken breast on my way home every night, and that's what he eats his whole life. Like, how long have you had him? She's like, 9 years.
Shut up. He's been eating Church's chicken for 9 years?
I was like, I'm gonna go get I'll be right back. And I had to like lock out of the room because I couldn't hold it together. Like So that's probably why this dog was like greasy and weird hair, and it was because at the time I wasn't on this side of the table yet. I was still a tech, and the doctor was like, "You're full of like, no, there's no way that she's not feeding fried chicken." I was like, "Go in the room." Like, I'm not making this up. I don't know what to tell you.
Bless her heart.
Oh, such a Southern loveliness.
Yep. That was.
That's
when I realized I did not want to go into practice in a rural area.
No. I mean, don't get me wrong. If I brought a Church's chicken home, I'm a KFC fan personally, he'd go nuts over it. But 9 years, good Lord.
Yeah, I don't know how that dog hasn't died of pancreatitis. Like
right? I was just like,
now I feel really bad because Precious Bear, if she doesn't have chicken in her bowl with her food, she looks at it and she sits back. Well, now it's I make the chicken, but she looks.
A little bit of homemade chicken, greasy fast food chicken every day for every meal and nothing else.
Totally different. Okay, good. I feel
no dog food.
That is exactly why 1-800-VETS is now.
Now.
Oh yeah, I mean, and
there we go.
No, and now I've had to have the nutrition talk a ton lately because of the whole grain-free diets and heart disease and all that stuff that's out. And it's tough because a lot of clients that have come to see me at the last few places I practice tend to be a little more of your like Whole Foods, Trader Joe's, organic, hippy-dippy sort of things, and they want to feed the same to their dog. And it's like, I get it. Like, I used to feed that to my dog too. I understand, but we have things that are kind of scary on the correlation side over here, and heart disease I can't fix. And if you could only eat like one plate of food the rest of your life, who should make it? A nutritionist or a chef?
Right. Exactly.
Tell me who should make your one plate of food you're going to eat over and over.
That nutritionist all day.
I had to learn that lesson with Precious.
Oh, yeah. Same with Bear. I mean, we've had to change. I mean, his diet has been expensive. Now I'm doing the prescribed diet for my vet because we're just trying to take everything out because I had him on one diet and it was a little bit more expensive brand, and he was good for about 4 months, and all of a sudden it just something switched and nothing was solid when it would come out. Went and we did the exam, the fecal exam, and they're like, well, we can switch it to I should know, I'm looking at the back, Hillside.
Hills,
yeah.
I
was thinking the hills have eyes. I was thinking of movies. I've been watching so many movies.
Well, it's Hill's Science Diet. So
Science Diet. Thank you. See, I'm thinking about. I've been watching like scary. I've been trying to watch funny movies. I've been watching everything. But yeah, I was like, yeah, let's go that route.
Hillside eyes.
Well, we'll get ready to finish up, but just real quick, Doc, if you can just kind of give us a quick just recap again on like what you guys do, what you offer, and then I'll finish this up and close.
In COVID-19.
You want me to talk about that again?
Just a brief little, because I have too many people asking about it once again.
Perfect.
Just pop up.
I'll start with that and finish with us if that works. So
Perfect.
yeah. So disclaimer again, no infectious disease expert, not an epidemiology expert, but again, for people who are interested, the AVMA, American Vet Med Association, the World Small Animal Vet Association, WSAVA, the USDA, and the OIE all have excellent resources. They keep them up to date every 3 to 5 days. I'm seeing updates on at least one of those pages with new information that will kind of go into a lot of detail as far as what we've seen in any sort of non-human testing. So that includes the couple of dogs and the cats that have tested positive. That includes the case of the tiger in the zoo. But the most important thing is there have been no evidence at this point to indicate that with natural conditions, the pets spread COVID-19. That is not a thing that we have seen any evidence of. There's no evidence through the CDC or AVMA of any pets becoming sick from COVID-19. So your pet is no different than a doorknob when it comes to coronavirus. And what I mean by that is if it comes into contact with someone who is sick, if someone who is sick is within 6 feet and those virus particles get onto your pet in some way, shape, or form, your pet can carry them just like any other object to another person that can catch the virus off of them as an object. So fomite, if you want to use fancy words. But that is the only risk they really have. So if there is someone in your home, in your area that is ill or potentially positive, keep your pet away. There are even facilities. We have a partner clinic that's actually offering extended stay boarding at a super discount for families if they have someone that's ill, where they can take their pet and just say, you hang on to them for the next 3 weeks so nobody in the house can kind of get split up and they have access to daycare and all those sorts of things. So there are options out there to keep your pets entertained and away from a home that potentially has that positive case. Mm-hmm. So were there any more questions on it? Is that cool?
Oh, that's great. Yeah, cool. Just give us a rundown of you guys.
So 1800VetsNow.com. We're working on getting the phone number to call up and operational. For now, it is a web-based platform that you come to our website, you engage through our technicians and doctors via almost kind of like an instant messenger or a chat function. And once we assess, what's going on, how is your pet ill? Do you just have a bunch of questions? Because we can chat all day long if it's questions, but if your pet's sick, we're going to want to talk to you. It's a lot easier to have that conversation and ask questions rapid fire rather than try and type everything back and forth, either through video chat or audio. Answer questions about any condition or anything that you have as far as pet health, and whether it's diet or behavior or a disease your dog's been diagnosed with that you're wanting to learn more about. And then we also provide teletriage services. So it's the ability to help you determine what's going on with your pet and do you need to be seen? Is it an emergency? Is it not? What do we really think this could be? And we'll kind of help you go over the list of, these are all the things that can cause what we're seeing. Some of these are quite scary. Maybe we should go be seen and get those scary ones off the list so we can be more conservative. And we have a network of partner clinics throughout the country that we can immediately get on the phone, get you scheduled, get you coordinated, and find a trusted vet that you can see and have your pet taken care of.
Perfect. That's great. Well, I'll close this out. I just want to thank everyone who tuned in tonight. Also, thank you, Dr. Jason Epstein, for jumping in and being a part of this. It was great.
Thanks for having me.
And the fact that we now know that we have a place that we can go to kind of get questions answered before we jump in straight to the vet, because I know a lot of people kind of get nervous on, is this an emergency or not? And for a free service, it's great. I think what you guys are doing is amazing. And for everyone who tuned in, we just want to thank you guys again. I know there's a lot of hard times going on, so we're trying to bring you as much entertainment, laughter. We did sort of hit the little sour spot there for a second, but we tried to bounce back as fast as we could. No, we would never. It's definitely Cat's fault. But thank you guys again. Please like, subscribe, share. If you watch any of this, tag us in it so we can repost it, because there's a lot of people who are just looking for something new to do. We try to bring a new spin on things, especially for the area, but we know we've got some viewers all over, so we're just trying to help out where we can. So thank you guys again. We'll be back here again next Tuesday at 7:30, not 7 o'clock, Cat. We will see you guys then. Dr. Jason, if you want to stay on for 2 seconds, we're going to close up. Tom's going to roll us out. Everyone else, have a good night. Stay home. Stay healthy. Go hug your dog. I'll hug Bear, who's passed out right now. I just want to stand up so I can get my leg feelings back.
So you can feel your toes.
Thank y'all.
Love you guys.
Thanks for joining us on Music City Fitness.